particularly thrilled to be here this morning because out of a dozen or so panel sessions that I've either participated in or been involved with for healthcare and blockchain, this is the first time that I've been able to do it with all clinicians. So coming from the HIMSS standpoint, this is enviable because we kind of get together and we all talk about blockchain, and it's the same folks talk about blockchain, but now we get an opportunity to have some really knowledgeable, outstanding clinicians who are involved in this space that I've had the chance to talk to, the privilege to talk to the last couple of days in preparation for this panel session, and bring them up now. Are they all mic'd up and ready to go? And so I'm going to tee this off with a series of questions and walk through some of the topic areas to kind of just stimulate those discussions around clinicians and blockchain use cases. But first, if I could, I'd like to ask each of the panelists to spend a minute, introduce themselves, give a little bit of their background and their interest into blockchain for coming here today.
So I'm an orthopedic surgeon, and my interest in blockchain started after my practice had a data breach. We had a breach of approximately 400,000 records, and it sort of got me interested in how something like that could happen, and sort of learning, trying to learn about cybersecurity, and I came across this, this blockchain thing, and tried to start reading about it and understanding it, and sort of went down a rabbit hole. But so for probably about 2 years now, I've been interested, and so I'm happy to be here and sort of have this discussion.
Hi, good morning, everybody. I'm Suhail Chughtai. I'm a practicing orthopedic surgeon in London, fellow of Royal College of Surgeons, and also Microsoft certified specialist, and have been developing IT-related applications, now telehealth software, for the last 5 years, and under the name of Medical City Online. So we have about 25 projects in different countries where we are acknowledging, giving licenses to people to see patients over internet. This brings the interest in blockchain, because I think the wrap of blockchain, the intercept of blockchain on telehealth is obligatory. It's going to come, and that's why I'm here.
Hi, Jack Neal, Chief Technology Officer for MedStream, also a pediatric anesthesiologist, and I have a startup as well, Zather, which is a crowdsourced data marketplace. So lots of different things going on. Blockchain fits into some of the projects, use cases, and I've been involved in blockchain since I started mining it back in 2013, and then followed with Ethereum and smart contracts, which kind of opened the door to at least public testing on the public networks. So there's a lot of excitement, and I think being involved, there'll be a lot of pivots in the future as companies look to utilize blockchain. A lot of things won't be possible they thought were, and blockchain will evolve into probably more of a distributed ledger than just pure blocks. But anyhow, that's getting on to our discussion. So thanks, good to be here.
Good morning, everyone. I'm Joe Wood. I'm a clinical endocrinologist. I'm also a health IT researcher and digital health researcher. And my main role currently within the organization that I work is in development of virtual health services across a large region. My interest in blockchain technology stems from my involvement in cryptocurrency, as many of you may have played with it. And once I used the technology to buy, trade, exchange, transform cryptocurrencies into different forms, I saw very obvious translations into healthcare and various processes that are complex within the healthcare ecosystem. My team and I are currently working on blockchain use within the provider credentialing ecosystem within the DoD, and I'll leave it at that. So thank you.
Excellent. Thank you very much, gentlemen, and thank you again for the opportunity to be here. As part of this panel preparation, as you know, some of the things that kind of bubbled to the surface that we were talking about related to blockchains and electronic healthcare records. So if I could kind of get your perspective each in terms of blockchain being the EHR of the future or its complementary nature, and how you see it fitted in respectively from each of your clinical perspectives, that would be great.
Well, yeah, I think for me, the EMR question, I think that's really truly the holy grail of with blockchain having this ability to be a platform of trust, and with the ability to allow patients to have full unfettered control and access to their information. As a practicing physician, it's maybe every day or every other day where I'll see a patient that comes to my practice that comes from somewhere else, and the redundancy of information that's required is staggering, and it's frustrating to the patients and providers alike. And I think that the blockchain potential is that could allow patients to have more control, and in addition to the ability to monetize, but just simply from a frustration standpoint, I think that this technology has this potential to make patients more empowered. Now, I certainly think that there's a long way to go to get there, and in my opinion, I think that easy wins are important for blockchain. I think that things such as credentialing or informed consent, things that are more simple, I think are a better roadmap as opposed to tackling EHR initially because of a lot of the things that were mentioned in the last talk.
I think we saw a wonderful video which Ron shared. There were 3 seconds interval when the hands came off the steering wheel. Actually, it's 30 years. That confidence to leave the hands of the steering wheel took us 30 years. So the healthcare is evolving as well. Now we have a very clear indication that good clinical history, visual examination, medical records review is enough to make a safe range of diagnosis on telehealth. So we are changing. And with that comes other issues like how can we make the thing secure? Doctors are considered responsible for medical health records, or at least part of the responsibility is shared by the doctors. That has to change because doctors are doctors and they're clinicians. Their focus is on clinical management rather than data management. So there comes the benefit of blockchain, which I believe strongly, and I spoke to Krissa a few months back and she convinced me to really think about it. I've read about it and I feel that blockchain has many intercepts. For example, it improves the patient data management. And that's a critical word, patient data management. We have different blocks of data lying scattered. Putting them in one chain and then calling that a block of intercept is a great idea. You have a Fitbit. Imagine a guy who has angioplasty done 6 weeks ago after a mini heart attack or a simple ischemic episode. That guy will buy a Fitbit, will require some ECGs, will buy a weighing scale, will get a dietitian. All this information is useful, but where does the doctor see that? In the clinics. We don't. We're trying to struggle to find it. So putting all of them together is improving the data. Then comes the patient health management. So data management, health management, because patient is now more seen as in a bigger canvas. We know about the patient sitting next to me in a clinic in a much better way with all the data visible to us. And then comes the practice management, the invoicing, the billing, the eligibility check is in real life testing. So all of this together, the data, the health, and the practice management makes it much easier on a blockchain rather than individual side. I mean, imagine that a house has very secure rooms. Everybody is sitting there. We know that in that room we've got data. We've got that person sitting there. But we can't see them straight away. We have to go out and get that. Why not put glass walls in that house so we can see what is in that room, but still secure? I take it blockchain is a house with glass walls, where we can see in each room, but we are still sitting in our room. So I'm very interested in blockchain taking us forward.
So I'd say, let me pull this closer. So I'm already short. That was making me shorter. So maybe 10, 15 years ago, Google tried doing a Google Health Cloud system. I think, the problem of medical records being, siloed into different entities clearly annoys the patient. It affects the UX. And it also affects the providers. It makes their life absolutely miserable. And also legally, we're scared of the medical legal aspects because a lot of times we're expected to have access to that record, and the hospital technically gives you access, but you can't possibly review all the different disparate, yeah, maybe that's the word, sources of the data that currently exist. So Google tried to do it, but in that case, if you try to do it the historical way where a company, an entity, you're saying that I'm a better, trust me to hold it. My cloud service, everybody send the data to me and then I will parse it. I will allow access. The problem with that is, there's still an entity unless that was run by a national health service or over in England or something else. Still, how do you trust that company and how they're going to try to monetize it at some point? So no one wants to place their data into someone else's hands because they're going to monetize it some way, shape, or form. Or if they lose it, you can get fined or there's regulatory issues. So with that being said, that didn't really go well. That kind of got shut down, or at least publicly shut down. So then blockchain sort of is an iteration on that, I would see. It fixes some of the problems with the monetization because there's no true entity that owns it per se. It handles access as well because of the source code, at least for smart contracts, if that's what we're talking about here. You can see and you can actually piece through who has permission to access the data, so you can understand the data that you're giving up, what's going to happen to it, from the patient side of things. So that's all beautiful. The challenge is the regulation right now kind of says all that's not legal. So based on the HIPAA security rule, which I'm sure will change soon, there's no entity to sign the BAA unless it's a semi-private blockchain or distributed ledger. But so you're still a little siloed. So that's I think that's what we're here to talk about, is how do you move past that issue where instead of it just being another type of database, how do you actually get it to where it is where we want it to be, which is that universal place where all medical records are stored and it fixes all our problems with getting the healthcare data. That's what we all want, but that's what these discussions I think are looking to slowly inch toward, is that solution.
A little bit of audience participation. How many of you have 24/7 access to any of your healthcare data within your healthcare systems? A few of you, that's great. How many of you have 24/7 access to all of your healthcare data? I actually do, in an unusual situation where I'm both a provider and a patient within the healthcare system. So I can access all of my healthcare data 24/7 anywhere on the planet.
I think that's a PHI violation.
I would argue that everyone should have access.
You can't look at your records.
That's right. Stop that stuff.
Busted.
Can we strip that from the tape? We don't want that to.
So what's interesting to me about that, although I have access to all of my healthcare data, and I've been in the same healthcare system for over 20 years, I don't control it. And I think the consumers or the patients, I still call patients patients, but I do understand the concept of they are consumers. I believe ultimately that consumers and patients will change the paradigm of healthcare data and that they will own it. And they will decide who gets it. And if they go to a healthcare system that can't read their healthcare blockchain, they won't get healthcare there. I think ultimately they will drive it. It'll take forever to get there. And obviously there's some technical challenges with getting all your healthcare data on a blockchain. A lot of it will have to be stored off-chain because you can't store an MRI image of that data on a blockchain. It's too big. Your transactional rates would halt with large amounts of data. But to me, that's the real promise of blockchain and EMRs, is changing the paradigm to flip it around. So you would still have individual EMRs. Those readers would have unique attributes, but I would own my own data. I would control what healthcare systems do with it. So then imagine if you all owned your own data, that creates whole new ecosystems of technologies to develop and other ways to engage with AIs as a service. And instead of individual healthcare systems owning the data and doing with it as they wish. The blockchain, in my opinion, could also enable you as a consumer, as a patient, to know what's happening to your data. Right now, you have no idea what QI, PI projects a healthcare institution's doing with your de-identified data, but with permissions and smart contracts and setting up those rules with a blockchain, it would enable you as a patient to know exactly who's doing what with your data and for how often.
And Doug, I'd follow up on that for the rest of the panelists. Are you finding, as clinicians, are you encountering cases where either patients are coming to you, similar to Doug's fashion, who are interested in being empowered with their own data proactively, or are you having conversations with your patients around their ability to see their data and understand their data? And any of you may comment on that in terms of just what the trend would be for people to really be empowered with their own data.
Well, yeah, for me, I would say that, it's almost one of these things where I don't know that patients, I think it's been since 2015 in which one of the requirements through meaningful use and EHRs was the requirement for the availability of clinical care summaries. And, I think the question that wasn't asked, even if you have access to that information, how many people have actually done it? And the reason, in my opinion at least, is that, there's not value, or patients don't appreciate the value in the information that's provided. And in a lot of the portals and the systems that are available today, the reason for that is if you look through them, a lot of that information is patient-provided information. You have past medical history, you have medications, immunizations, allergies, all things that the patients know. I mean, this is not added value to those individuals. And so the full record would add some value, but those are, there are not very many systems that allow that full access to, diagnoses or to plan of care and those types of things. So for me, I don't have a lot of patients that sort of know that that's something that they should be interested in, but in my view, I think that it's all about, how do you change that, I guess, was the question. And in my view, I think it's about creating incentives. And again, that's the part of blockchain that I think is so fascinating, is that it has this ability through, economic incentives to have people engage. And so if you do create an ecosystem that, well, hey, there's patient information that I find valuable because, someone else thinks it's valuable, then that may be a way for people or patients to engage and want to know about what's in those types of transactions.
I think the healthcare is evolving faster than we think. There was a time when I can remember I'm seeing a patient and looking at a screen, and patient doesn't have the care to ask me, or courage to ask me that, what are you looking at? Can you tell me what this number means? Now I designed a software where I could see my screen, I can see a patient on a video conference. At the same time, I can share my screen. Whatever record I'm looking at, the patient is looking at the same page. And I saw patients asking questions. So they would not let me go to the next screen before they can understand what I'm showing them. And I saw a change. I saw that patients are more inquisitive than we think. But the problem is that we never gave them a chance. We never gave them a chance to ask. So when I shared that screen, when I created a software 3 years ago, it was just taken very popular because patients could ask questions. And same way, now if you give the right to patients to hold the data, understand the significance of that what they're holding is the key to their own life, then things will change. At the moment, patients are not encouraged to ask questions because of pressures. We have less time, we are tired, or we don't want patients to ask questions. Once we give them the chance in a blockchain system, things will change. And I believe that change is quite imminent, very close.
Yes, I'd say I don't think there's a large percent of our patients currently that access the charts even when they're available. But as the previous speaker alluded to, and I think this is coming quickly, and if we think of our own lives, like what would I do if I'm the patient? If I'm going to be spending out of pocket $1,500 on a CT scan, I dang sure want a copy of that CT scan. I paid for it. Like, if I want to sell it, let me. That's mine now. I bought it. Any other industry, that it wouldn't even be a question that this exists. So in that case, I think it's coming as people are more and more of a consumer than they are a patient. They're going to demand it because they're paying for it. And if there's any way for them to make money off of it, this is me being a little jaded by sort of my own personal opinion on this. But if there's a way for them to monetize it to help recoup some of what they had to spend on it, I think there will be a larger and larger push. And it's the time thing. As the younger generation ages, they'll do this a little more than maybe the current heavy utilizers, the baby boomers. But it's coming, and it might not be next year, but it's definitely coming down the road. So I think these types of blockchain solutions, these are really looking a little down the road, and we're building the framework and building the foundation for those cases. And like I said, there'll probably be a lot of pivots on the way.
I agree with the other panelists. I think that most of the patients that I see, also the majority, have never had the opportunity to really look at their data, but the numbers are growing. The patients that I see, whether it's through telehealth or in person, more and more want access to their data. They want to see it. They want to understand it. And when patients do have access to their data, if I as a clinician have educated them on what the parameters should be when they see their laboratory results, it actually decreases healthcare expenditures because they don't have to call me, they don't have to come back to see me or send a secure message to ask me about whatever their lab results are, because they can see them and they know what they should be. But that also, one of the exciting opportunities to me is by having full access to all your data, it creates whole new opportunities to create chatbots or other technologies to educate patients on what that means, as opposed to engaging with the healthcare system and taking up clinician time to answer those questions.
Excellent. I think that's great commentary. And again, to take advantage of the uniqueness of the panel today, from your perspectives as clinicians on the front lines and your view on blockchain, how would you like to see the regulatory landscape change going forward to perhaps kind of improve or better perpetuate some of these models we're talking about as far as blockchain is concerned? You're in the lead, man. You're in the lead.
Every time I'm first, huh? Okay. Well, I think the regulation is interesting because in most all cases, when you're talking about regulation, there's some jurisdictional, discussion about that. So when you're talking about regulation where? Are we talking about regulation in Switzerland or in the U.S.? In the EU. So in the U.S., obviously, the big regulatory hurdle in regards to EMR, at least, would be HIPAA. Okay, and what's interesting about HIPAA is that it is a patient protection legislation that, if what we've just been talking about was to occur, if the health systems own the data or practices own the data, then HIPAA is in force. But if the patient owns the data and the patient arbitrarily decides to say, well, any patient can relinquish their HIPAA rights through an authorization. So if a patient has the ability to sell data, for example, like we talked about, HIPAA really doesn't apply. And there's really never been any reason that patients would do something like that, again, unless there's some incentive. So, I think that the regulation, as it stands for blockchain specifically, doesn't really exist. They're still trying to understand it, like a lot of people are, and so it's a matter of them catching up. Now, one thing that I do think is interesting, I don't know how many people have followed this. May 25th was sort of actually a pretty important date recently, where in the EU, the GPDR, I think is what it is, it's basically a law that came into effect, or I think it was passed a few years ago, that came into effect just last week, that provided additional protections for consumers for websites and data collection services. And probably everyone was getting emails last week about change of terms of service, and that's what that was related to, was to that legislation. And I think it's interesting because that really had that doesn't apply to U.S. citizens or really anyone other than EU. But because these companies that now exist that manage this data, these are global transnational companies, that legislation and those regulations will benefit everyone. And so, the regulation question, I think, is evolving. But I do think that also through this process with the EU, people are becoming much more aware of these privacy rights that they have, which was one of the purposes, and having access to their data. That was one of the other parts of it, is that people now in the EU, at least citizens, have access to view their information from these sites and delete it if they want, or use it in ways that they want. So I think those are some really recent things that are actually pretty interesting.
I think this GDPR inclusion is we faced in London practice on 25th of May, and I'm still answering those emails. Do you want me to keep your data or delete it? And there's a long plethora of these emails I'm still having to respond to. I think the respect to regulation comes from the trust in the governments. And in Britain, I'll give you an example of that. We have a great respect for the governmental regulations, and we know that they are there for a reason. That is the first step towards actually changing any software, let's say healthcare software, that we understand this change is for a reason. The healthcare software is different. We have to decide that do we have to apply regulation to all of it or part of it? I'll give you an example that patient education modules in telehealth software, that doesn't require to be regulated. It's a simple webinar system where a doctor goes online, a nurse goes online and tells the mother how to use an inhaler. We don't need to put blockchain intercept on that part. So we need to really segregate the points of intercept in the telehealth system, that where the blockchain has to come in and develop the ready APIs or smart contract in blockchain. That these are the ready-made APIs for that blockchain system. So that is that EMR, that blockchain, they can shake hand in 1 week. Rather than developing a complex process of learning an EMR system, learning a blockchain system, let's understand that this has got to be regulated. So as EMR owner, I must develop handles to handshake. And then the blockchain companies like Patientori, they should develop the ready-made handshakes as well. Rather than thinking again, deciding again, sitting down and planning again. So regulations, it's just like driving left-hand side car in America. If I understand this has to be there, so I can't drive on the right side of the road in America. So we must respect the regulations. They're there for a reason. This trust comes from the government's ability to think clearly and share clearly as well.
All right, I'll try not to be too technical, but this might be. I think if we're just to try to narrow the scope, if we're just looking at like the use case of healthcare and blockchain, if that's just all we look at, first off, what's being stored? So what's healthcare data? We talked about that in the last speech. Probably almost everything can be considered healthcare data nowadays. So if you're going to store that on the chain in a duplicated manner, then you have to encrypt the stink out of it. So you have to encrypt it so strongly that at least until quantum computing comes, whenever that comes, it's encrypted. And hopefully just it's long enough that you're dead before it gets brute force attacked. That's the goal. So in that instance, what regulation could be crafted to do it? I mean, so the solutions for that are if you're going to store data on the chain, if you're the entity, if you're the hospital, if you're the provider, and you're going to write a record encrypted onto a blockchain that's going to be distributed, with numerous copies on I'm talking about public blockchains here, then it's got to be encrypted so strongly that it won't be broken theoretically in your lifetime, which can't be proven, but it's probably true. So how do you craft regulation around that? If you said, oh, that's okay as long as you encrypt it really strongly, that's assuming that encryption algorithm won't ever be broken. And if it is, then all that healthcare data is wide open. So how do you, I don't know how you write a regulation around that. So then your other options are try to regulate it where the healthcare data cannot be stored specifically encrypted on the blockchain, and you store it offline and have pointers and links to it. Well, in that case, the blockchain really is just more of a identity management, which is, I think, one of the first use cases that makes sense. And that doesn't really need as much regulation. So if you're talking about true regulating, putting healthcare data on a blockchain, I think that's a very complex, almost impossible currently task to write rules that make sense about. I think the industry has to think through before they do it, because they're going to the entity will be in a lot of trouble and face serious fines if they just do it and ask questions later. That doesn't work in healthcare. I think we have to sort of come up, just like the ICO problem, you have to sort of come up with your own industry standards and best practices. I think that's probably first before regulation, because the regulations, I don't see it coming soon in any meaningful manner.
I would say, regulatory oversight of healthcare data is obviously in the context of who owns the data and who controls it. Currently, privacy rules, HIPAA rules were all developed and constructed to protect the patient, because the patient does not own the data. So on two ends of the extreme, you have institutionally owned data that patients have no access to, therefore you need HIPAA and privacy rules. On the far end of the extreme case, it would be all patient consumer-owned data. Then those rules you don't really need them. You need other security rules and compliance to ensure that data really is secure. So I see as healthcare transitions from an institutional owned data set that's complied, the compliance is through HIPAA and privacy, there'll be a transition where you'll need different types of rules and regulations to ultimately cover patient and consumer-owned data, and there'll be a transition where you would need both. And there'll be instances where, depending on where you are, one would apply, one wouldn't. And so there'll be some hybrid approach eventually.
I agree, and I think my concern is that as that happens, which I think is actually what's going to organically happen, there'll be some hurt people. And I don't mean physically hurt. I just mean that they won't understand that this, what they believe to be secure. Again, they didn't get the benefit of the regulations. I think there'll be some hurt people, and rules will come then. But
yeah, there's a lot of things that we don't know as consumers. Whether it's your IoT devices, you have no idea who has access to your data. Therefore, there's all these rules and regulations that need to be built because of that. But if you are the sole owner of all your data on the extreme end, that's a totally different paradigm, and that to me is quite exciting.
And I'll say, it's also sort of scary because, and I think about when I first sort of, invest or bought some Bitcoin and sort of tried to secure it and try to understand that, when there's no one to call, when there's a problem, or, that can be something that for a lot of people is, that's can be an issue. So I think a lot of this, what has to occur is education, and even in the healthcare system, it's going to be important if you get to that point to say, well, look, you're responsible, but you're responsible, and I think that's an important point to that will have to be made as these things roll out.
I think the good thing is the hashtag. Mm-hmm. The hashtag in every entry you make in blockchain, a hashtag is created, and that hashtag is time-stamped, and it's a unique hashtag, which means if someone wants to change it or append the record, that hashtag will not remain the same. So that hashtag will be actually the key to one of the securities. It's better than SSL security or double-level encryption security. So we got to understand that hashtag is not the hashtag we share on Facebook or YouTube or other places. It's the hashtag is the key to the security of blockchain. If I'm right, and maybe Chris, I can show more, can tell us more about it.
Excellent. And just to key off that last point, because Alonzo, I think you're reading my mind, my bonus question here is, so Dr. Rubitsky touched upon, obviously, medical devices and all the information. We brought this up already in this concept of patients being empowered with their data. My personal question is, or my concept as we go forward, is with empowerment comes responsibility. So how do you see this evolution perhaps with blockchain and with other technologies that now patients will be empowered with their data, which inherits responsibility and immutability and transparency as to medication adherence and follow-up with protocols. Any of you could comment as far as how you see that just kind of evolving, where patients not only being in charge of their data, but will also have to take responsibility for the care that you offer to them.
Yeah, I think that will be just like every other technology insertion into any process, enterprise, or person. There'll be a bell-shaped curve. It'll be your early adopters and innovators. So that'll be the minority of patients that'll do that initially, but in the end, somewhere down the road, if the user experience and the user interfaces are good, then you'll have everyone doing it. But for a long time, I think it'll be only the early adopters and innovators. You all know that curve, right? With any technology insertion, early adopters, innovators, everybody else, and then the laggards. So I see that following the same paradigm.
Yeah, I'd say so. One of the first places that I see is in medical devices. If you look, this is one of the low-hanging fruits, I guess. The base of blockchain and any of these technologies is basically identity. You got a public address and a public key and a private key, and it's cryptographically. This is the entity. You can't just say, "Oh, I am Jack." Jack has a private key, and if you don't have my private key, you're not me. So by having devices have that embedded into them, you'll be able to have devices self-report information that can't be changed, theoretically, can't be changed once it's written into the record. So you can have devices report on and off status. You can have devices report alarms or any other thing, even on the home health side, that's not going to Apple's cloud-based home. It can be written into a different ledger. And again, that device wrote that record. And then the human doesn't have to deal with private keys. The human has no idea any of this happened. It's just happening because that's how this packet was signed on the devices. So as the medical devices will be in the sort of low-hanging fruit when it comes to the user experience. They don't have a different user experience. They're just using the device and the record's being written. So that's where I'd see. I don't know if that was really the question, but
that's okay.
that's where I see it going.
I think if you look at the example of Rothman index, how many of you know Rothman index? Rothman index, when a patient goes home, You can have a collection of 5 or 6 indicators through smart devices like ECG, blood pressure, heart rate, respiratory rate, SpO2, and other things. And then they are plotted on a special graph. And that tells you patient is getting bad, getting worse, or improving. If it touches the critical low value, patient comes back to hospital. And this was inspired by Rothman's mother, who died in hospital some 20 years ago. So they studied the hospital records and found out that had this been picked up at home, the patient would have been brought to hospital and she could have been saved. Now, medical gadgets do the job. Medical gadgets tell this information to a hospital record electronically, so patient has faith on them. And I feel that patients get excited when you talk about a portable ECG recorder. They say, yeah, doctor, I'm traveling abroad. I want to carry my cardiologist with myself. Can I buy this? So yes, these devices are actually changing the paradigm of healthcare. The doctor, you carry your cardiologist with you, whether you go to Hawaii or any beach. So these devices are going to be one indicator when patient is involved constantly, because they feel that they can have a doctor 24/7. So the problem arises when you talk about security of this. Every software which integrates a device into a website, there is a special login password. You have to allow the doctor to take access to that. That is where blockchain should come. Blockchain should wrap that as a special gateway where a doctor, when a patient allows access to the EMR or the readings of the ECG device from the website, blockchain should come on top of that and control the access and make a hashtag at that point. So all this is possible. Blockchain is going to make it more secure. It's already attractive, but maybe more secure afterwards.
Great. I'm
Yeah.
sorry. Go ahead, Ralph.
Yeah, I was just going to add. I mean, I think your question is interesting because, as a physician, I think physicians are trusted third parties, right? People come to us because they put their trust in us to sort of take care of them and sort of when they're at their worst, help to get them back a piece of their life that they've lost. And one of the things that we've gotten very good at through, training and is managing data. And so we're, in a way, we're sort of these data managers that sort of know about HIPAA and understand how to sort of protect people's information as best we can. And, in the future, I really do believe that, this data is going to be almost as valuable as, the actual diagnosis that you give patients. And so I think, for us, it is going to be a situation where, as a physician, we are going to be somewhat responsible for helping patients to understand the value of what we're, what we're giving them in return in regards to this data. And so, just like if someone has an infection and we're giving them an antibiotic, we give them instructions about how to take the medicine, what the risks are, what the benefits are. In the same way, I can see a future where this data is sort of expressed in that same way to patients, where we say, well, this is your laboratory values. This is sort of, how you manage it. This is how you can use it. And so, I could foresee a future in which those types of discussions are had as well.
Excellent. I'm going to steal just a couple minutes more back for this session and open it up for questions because of the unique opportunity to ask clinicians about blockchain. We got just a couple more minutes before we break for our break, but any questions from the audience, from anyone who'd like to pose any questions today? Yes, sir.
Quick question. Someone spoke about Fitbit and the unavailability of that information. Is there a reason why you cannot access that information if a patient came to you and had a Fitbit record?
Is it addressed to me? I take the blame for mentioning Fitbits.
Yeah.
I think the patient has a right to refuse, and that is what smart contract is. Smart contract is when patient chooses this, tick, yes, my doctor can see that, this you cannot. So patient has the right to choose in blockchain, but not otherwise. So why would patient refuse to share the data of Fitbit? Apparently there is no good reason unless the patient doesn't feel this is important. But the patient who had angioplasty and they want to share the progress. It's like a patient incentive. Patient shares the progress on informal level with the clinician. Maybe the clinician did not request a Fitbit, but the patient wants to tell, look, I'm following your advice. I'm getting better. I'm going to gym. I'm doing all this. So it's an add-on. It's not an obligatory thing. I believe. Does it answer your question or?
Well, basically, in a way, because I am saying that is a method of having information from the patient to the physician. And if that is expanded to other areas, including medication management and any other management, then you have a full scope of what that profile is for that patient at any point in time, in real time. And all information that might have been stored in a provider's log that's no longer relevant. So how important is access to current data, and how relevant is it to physicians and persons who need it at point of care?
Yeah, most of our healthcare systems currently are engineered to bring that data in. So that's from the patient pushing the data to us. You know, in the old methodology, patients bring in stuff written on paper. Now there's a whole lot of digital data out there that they can share with us, but our systems, at least in my healthcare systems, they're not engineered to accept it.
Not capable of evaluating it.
So what I can do, I can accept your Fitbit data and put it in the EMR, but it takes a lot of steps for me to do that. And you have to invite me to be one of your pals on your Fitbit profile, and then I can see your data, or you can share it, or you can export it as a PDF. I can upload that PDF into the EMR. That's very laborious.
And I think more globally, I think that information is very important. I mean, typically, you know, a lot of the information that we get from patients is very snapshot. And so, you know, any type of longitudinal information that can be provided, I mean, that tells more of the story of what's going on with the patient.
And just one 15-second thing, I'll try, if I can ever do that, is that I think, you know, a lot of these devices, you bring up Fitbit, but so many not medical devices, but so many of these health devices are now just marketed to consumers because it's easier than going through the FDA regulatory pathway. So all these devices that are collecting data, what do we do with it as a provider? They are not medical devices. So if I make my decision based off of this device that did not go through FDA clearance because they sold direct to consumer, what does that do? Like, what happens if I'm wrong and I use a device that wasn't approved by the FDA? It's just thought. I mean, it's got good and bad things about it, but it's just another problem.
Well, you would expect that you would use it as a reference,
Right.
as the data, because if you know what happened 36 hours prior to that visit, when you were looking at that data,
if I could, that's great discussion, but we got a couple of people that wanted to.
Jim, I just have 10 seconds add on to this. There's a practical example we just did recently for King Saud University in Riyadh. We provided them Fitbits or some other ECG devices, and we set critical low values. If somebody's on beta blockers and the heart rate goes below 60, ping, doctor knows. So we can set critical values on Fitbits or other devices, and the cardiologist will be informed, these are vulnerable patients. Expect a call from them.
And you had a question.
Yes, so from the public health perspective, now we are also having the interoperability issues and the patiently identified information being used in research and so forth. How do you see that being an issue going forward if the patient has entire control of their data and it is not on a public ledger?
And just because you aren't my, so what she was asking is, if I captured it right, in a public health management situation, how do you see the changes about the person having all that information available to the blockchain that's not part of a public health system?
Yeah, this might be a selfless plug, but so I mean, there'll need to be there need to be entities whose job is to aggregate that data, and there's got to be incentives. There'll have to be incentives as well for the patient to, and some of the incentives might just be you get better care. You know, okay, you want to submit your hypertension data so that you can see what the best drug for you is based on large AI data sets. But you need an entity that's job is to aggregate that data back from people one by one, which is not as easy as a large de-identified data set, but now that ML can re-identify data sets relatively easily, I think that way is gone, in addition to the fact that now people want to own their data more. But so I think it'll just that's a new market, that's what I'd say, and I think it'll evolve because there's a need.
It's an interesting question. So, you know, I would question back right now, how do you get the data and how easy is it? We're not there yet from a healthcare enterprise so that patients own their own data, but certainly, and with that, there's also, you know, local, state, and federal regulatory things that you would have to wrap around, because if patients owned all their data, then public health agencies may have no data. And so, those things would all have to be negotiated and sorted out, right? So I could imagine that if I owned all my data and had absolute control of it, I would know as a citizen of my state or my country that I'm required to share certain parts of it, all of it, but I could define in what context. De-identified, I'm going to only share my past medical history. I'll share all the way to my genomics data, but it's de-identified. So it creates a whole new opportunity for developing policies and standards, obviously, and requirements as citizens and what to do with our data to engage with the public health sector. But right now, like I said, what do you do now and how well does it work? I would imagine, a national data repository that has all de-identified data from every citizen that could be used for public health purposes, longitudinally across a lifetime. How powerful would that be? And then how about like the NIH, if they had all those researchers had all their data in a de-identified repository that scientists around the nation could then tap into. Imagine how powerful that would be. Obviously, that's pie in the sky and way off, but the possibilities are there technically.
Yeah, I just got the wave in the back of the room. I'm afraid that I'm destroying the agenda and they're going to turn my mic off. So you can see the power of having clinicians up here and the interest we have in monopolizing their time for asking questions. So I do want to ask everyone to give a big round of applause for standing participation. And with that, I think we turn it over to a brief break before moving to our next session, and thank you.